Hi, I'm Dr. Rajani. Are facial fillers safe? Great question. Let's talk about it. This is a Raji's quick clip. Ask your questions here in the comments. Maybe I'll get to it. I try and get to them all. I have a list. We'll pick it off over time, but it's a wonderful question. Let's talk today about the safety of dermal fillers. So dermal fillers and safety. When we talk about dermal fillers, there's many different types. Most people refer to hyaluronic acid fillers. They're made of hyaluronic acid, which is cross-linked so it doesn't degrade quickly. The less common ones would be permanent ones like PMMA or Bellafill. And then really biostimulators, people still call them fillers, would be like Sculptra or Radius. They still refer to those as fillers. They come in and go, I want my filler. They're really biostimulators. Some are in liquid. Calcium, of course, is calcium in carboxymethylcellulose. Irregardless, we'll talk about relative safety. The things that are common would be like bruising, lumpiness, bumpiness, not liking the result, pain at the injection site. While those are side effects, they're almost to be expected side effects, and that's not the most dangerous thing we're worried about. People who are educated on them worry about two more rare, very rare, thankfully, problems. But because aesthetic services are optional, it's not something you have to have done. When you talk about safety, safety's relative. Coming here today, I drove a car. A lot of people would say the risk of the two problems, particularly blindness, we'll start with the worst, is about less than the chance of getting into a bad car accident. What is that? 1 in 10,000 to 1 in 100,000 is what you're going to hear. And that's per syringe injected. So out of 10,000 syringes injected, it could happen once. 1 in 100,000, more towards that would be an accepted number. But understand that when you talk about blindness, a lot of the data is also with fat and hyaluronic acid fillers, and it can occur with other injected products that are not fillers, such as steroids and stuff. But in general, that 1 in 10,000 to 1 in 100,000 will be the number you hear floated around, and then it becomes relative risk because there are things that people are doing that are way more riskier than their fillers. But it's in the mind of the person getting it done because aesthetics are optional. They came in to have something done that maybe society, their spouse, their friends would consider unnecessary. Maybe they're even chastised for getting something like that done. And a lot of people can feel like that getting something like that is vain, or there's other emotional ties to that. And when something bad happens, it doesn't sit well, of course. But that would be blindness. The next is, say, necrosis, and that's when there's a death of skin or a death of tissue due to lack of blood supply because the filler stopped the blood supply or occluded the arterial vessel that carries oxygen. They can often be reversed with hyaluronic acids, as can blindness. There's data on that, a whole nother topic. But they need to be recognized, and sometimes they're not recognized for day 2, 3, or 4, and it's often too late. And it's all about, of course, saving tissue, just like anything else that stops blood supply. That risk, it's hard to quantify again, more common for sure than blindness. And it's going to depend on the method that was injected. It's thought that cannulas are safer. However, there's no good study on that. Certainly technique. There are people that do injections, I don't want to say better than others, but with a safer technique. Let's put it that way, to be kind. And then there's just bad luck, and it's a numbers game. If you do enough injections as a provider, you are going to see side effects. So the aforementioned ones like bruising, like pain, like nodules, like irregularities, not liking it, those are normal things. We don't consider, while there's side effects, they're more bothering issues. More dangerous would be the other two that we're talking about. There are other things that can happen, but just remember, do your homework, go to a provider who's continually educating, who cares about your outcome, and when you get a consult, you're going to get a feel. Are you in a good place? Do they care? Do you identify? I have a whole video on how to choose your injector. So watch that video, stay safe, it's all relative, and get a great consult to make sure you get the results you want in the manner that you want them done. Please join here, subscribe, click like, become part of our family here. Join me over on Instagram. Keep your skin and body beautiful, healthy, and vibrant.